epidural is an anesthetic injected into the spine that causes a loss of sensation below the waist, which also results in a loss of pain. Parkview anesthesiologist Dr. Anthony Chang explains the most common uses of an epidural, as well as the benefits.
We use the epidural most commonly for women having labor. The epidural basically is a block that we put into the spinal area, and then we put a small catheter similar to what an IV is, and then through there we can drip medicines, and then they're blocked from pretty much waist down, and it blocks their pain.
The epidural is administered into the body at room temperature, causing a brief cooling sensation. As the medicine settles in, so does a warming sensation of relief.
Placement really is usually fairly easy, and pain relief can be very quick. Once the epidural goes in and the medications go in, oftentimes temporarily feel everything get nice and warm and mellow, and all of a sudden their pain sort of dissipates. Within a few minutes, oftentimes people who are in tremendous pain often are ready to take a nap or smiling and laughing again because they feel no pain.
An epidural provides much needed comfort to an expecting mother, but is it safe for the baby being delivered?
Having an epidural increases the blood flow to the uterus and probably can help with contractions and help with the flow of the labor. The medication that we put in the epidural only stays in the epidural space, and very little of it gets to the bloodstream. So the baby actually sees very little of the medication. Babies generally do very well because the blood flow to them, and therefore the oxygen delivery to the baby, is actually improved.
While the length of treatment is dependent on placement and the amount administered, it is important to be patient during the recovery process.
Depending on the local anesthetics, their legs may be a little bit more or a little bit less numb. The nurses will not let patients get up and walk around anymore, only because their motor strength and balance is not perfect, but this wears off as the epidural wears off. The best thing to tell people, be distracted. Here's your baby, hold your baby, touch your baby, talk to people, watch TV, but just do something that you're not thinking about it, and just like at the dentist's office, it wears off in time.
This has been Making the Rounds, brought to you by Parkview Health.